Hi everybody. I've been normally sharing some pediatric education videos with you. This is basically because I am a pediatrician. But many people have written to me to talk something about COVID. I have resisted from doing so because my knowledge about that subject is rather thin. But something which I came to read recently made me change my opinion, at least temporarily. In these difficult times, in these very difficult times, the basic question is whether there is light at the end of the tunnel. Understandably, there is a feeling of depression and despondency all over. People seem to pin their hope only on the vaccine, and that is the only hope. That seems to be the only hope the public and the medical personnel have. Understandably, the crucial question in everybody's mind is when will we have a vaccine? The honest answer to this would be, or the obvious answer to this would be, when a candidate vaccine is demonstrated to be safe, effective, and available. Note this point, safe is the most important thing, but they also have to be effective and available. And that can be determined only by scientific data and not by a target calendar date. Now, this is something which the public doesn't like to hear from us. And this is not something the politicians would like to talk to the public in general. Unfortunately, but such a response is not what the people aspire for. They want a vaccine at the earliest, and they would like to have some good news from you. But the recent FDA guideline on testing a COVID vaccine, they say that there will be no compromises made when it comes to evaluating the safety and efficacy. Some of us feel, and in fact many of the medical personnel and general public feels, somehow they will push through a vaccine. Not like old times when it will take 5 to 10 years for a vaccine to come out. They will have to make some compromises on safety and efficacy. Safety at least, not efficacy. And then a vaccine will be ready at the very fast time. The regulatory authority will be less strict. But the FDA has made it very clear that there will be no compromise on this. Therefore, why is it so? Why is it that the regulatory authorities are very strict and not going by the public opinion? One should keep in mind that most vaccines will be given to healthy individuals, particularly children. The first determinant of a vaccine's future will be its absolute safety, and efficacy will come later. Because past history has taught us that even the slightest of side effects will produce a total failure of the vaccine because the public will not accept it. Even when the reaction is not scientifically proved, as the relationship between pertussis vaccine and autism is. Therefore, no regulatory authority will sanction a vaccination unless it is absolute. Now let's find out what we know about this relatively new disease. Now, please note one thing here, that whatever I am talking is from the latest journals, and the one which I am mostly referred to is the New England Journal, which published these articles just about 2 weeks back. I am talking on the 22nd of September, and this article was published on the 8th of the same month. The other article which I referred to was almost on the same month, is on the same month itself. Well, let's see what we know about this particular COVID, regarding the chances of a vaccine. We know that 90% of the population are susceptible to COVID. We don't have an innate immunity. It is a virgin land as far as the virus is concerned. And it's a new virus, and we have a population which has no immunity against it. Now, what we want is to end the pandemic at the earliest. Now, this is the problem here. This is the situation. Now, for that to be acquired, the great minds in infectious diseases have told that at least 60 to 70% of the population should become immune. if you are going to immunize and produce vaccine alone is going to do that, 60 to 70% of the world population will have to be immunized. And that would be about 5.6 billion people. Now, can we do it by vaccination? Almost an impossible task. It's going to take years and years, even if a vaccine is available immediately. Now, what is the other method? Is this the only way? See, the public doesn't become immune just by vaccination. By natural infection, also, you can get the population can become immune to the disease. The natural infection, when it produces disease, normally the patient becomes immune to that particular virus. Though there are reports of a second attack of COVID, they are rather exceptions rather than the rule. Therefore, generally, if you suffer from the disease, normally you will not have a second attack, especially in a viral infection. Now, that is not the way which we would like to get immunity in COVID, because COVID can kill us, not all of them, but we would like to have asymptomatic infection. Now, when you get an asymptomatic infection, if you suffer an asymptomatic or something called a subclinical infection, you don't develop the symptoms even, but you develop immunity. That would be a good idea. Now, let's look at the mechanisms by which we can prevent this COVID disease. The three basic principles, the basic actions which is available to us is: one is hand washing, the second is safe distancing, and the third is masking. Many medical personnel, many public as well as medical personnel believe that we are promoting this because we have nothing else today, nothing else with us, and these are not all that effective. And that's why everybody is crying for the vaccine. Now let's take up one matter today, the mask. When you do masking, it doesn't take much of a teaching to understand that it protects the community at large because the droplet spread is less. But what people don't realize often is that it protects the user himself. That's not something which even some medical personnel would know. And it decreases transmission, of course. It decreases transmission, but also decreases the severity of the disease. Number 4, it is the more and more infections becomes asymptomatic or they become less severe. Now, what happens is when there is more and more infections which are asymptomatic, it decreases transmission. And therefore, it increases the immunity of the population in general, which we call the herd immunity, and prevents the spread of the pandemic. Now, you may ask me, what are the proofs? What are the proofs for all of this? Now, this is a relatively new disease, but still already evidence is accumulating. And let's look at the timeline, how initially there was a flip-flop. Initially, they said, even the WHO said the mask was not that effective. But later on, they started promoting it. Now, let's look at how this happened. In March, reports started to circulate describing the high rate of SARS-CoV-2 viral shedding from the noses and mouths of patients who were pre-symptomatic or asymptomatic. And these shedding rates were equivalent to those of symptomatic patients. Therefore, it is not only symptomatic patients who coughed and had cold, even asymptomatic patients were actually shedding virus. That was the first thing which caught their attention. Therefore, the CDC on April 3rd told the public that they should wear cloth face covering in areas with high rates of community transmission. They advised for the mask for even asymptomatic people or the public at large on the April 3rd. Now, what you should understand is the mask not only protects the others, but it protects the wearer also. This is something lost to many people don't realize. Now, the past evidence related to other respiratory viruses indicates that facial masking can also protect the wearer from becoming infected by blocking virus particles by entering the nose and the mouth. Therefore, you are wearing it for your own sake. Now, this evidence has actually come in even before the COVID in bird flu and other diseases, mainly from the Asian countries. But the Western data started coming. From Boston, actually, they demonstrated that SARS-CoV-2 virus infections decreased among healthcare personnel after universal masking was implemented in municipal hospitals in late March. So this is a very important point which the public should be educated. Now, masks also reduce the severity of the disease. This is another advantage of masking. Now, you know that COVID-19 has a protein ability to cause different clinical manifestation, ranging from a complete lack of symptoms to pneumonia, acute respiratory distress, and even death. Now, when you put on your mask, what happens is the virological, epidemiological, and ecological data has led to the hypothesis that facial masking may also reduce the severity of disease among people who do become infected by filtering and reducing the viral load. The crust of the matter is it decreases the viral load which is spread. Therefore, the patient tends to develop less severe disease, at the same time developing immunity. Therefore, your mortality, morbidity comes down, and that's what we ultimately. When I make a sweeping statement that that masks reduce the severity of the disease, you are likely to ask for evidence. Definitely. The typical rate of asymptomatic infection with COVID-19 was estimated to be 40% by CDC in mid-July. Was 40% had asymptomatic infection. But later they found out by studies that asymptomatic infection rates are reported to be higher than 80% in settings with universal facial masking. And countries which have adapted population-wide masking had fared better in terms of rates of severe COVID-related illness and death, which in environments with limited testing suggest a shift from symptomatic to asymptomatic infections. Now look here, this comes in a Western journal, but it seems to be very much applicable as far as I am concerned to India also. If you look at how much for masking the Western countries have taken to, especially United States, is very bad. And therefore you find that mortality is much higher there. But let me tell you, this may not be the only reason. The other reasons which I told are that probably that the climate, the temperature in India is much higher. Therefore the COVID virus is not able to survive outside the human body for long. There may be a different strain. All the reported deaths, we are not reporting all the deaths. But in spite of all this, one feels that the increased use of mask, or in other words, or put it differently, the very low use of mask especially in United States has probably contributed to an increase in the mortality in spite of the very good treatment care they have, very advanced treatment care which they have in that country. Now for some more evidence that masks decrease the severity of infection, because this is a very important point. See, in an outbreak on a closed Argentinian cruise ship, for example, where passengers were provided with surgical masks and staff with N95 masks, the rate of asymptomatic infection was 81%, as compared with 20% in an earlier cruise ship outbreak without universal masking. And you have also found out that the case fatality rates in places where masks were enforced, where mandatory masking was enforced, remained low, even with resurgences of cases after lockdowns were lifted. This is what we find in India and especially in Kerala. Now there's a severe resurgence of cases, but the mortality even now has remained low. You can have a natural doubt. Is it not better totally to eradicate the infection by vaccination, just like we did in smallpox, rather than just by masking turning a severe infection into a milder one. Now, even in vaccine, the most vaccine trials include a secondary outcome of decreasing the severity of illness, since increasing the proportion of cases in which the disease is mild or asymptomatic would be a public health victory. Not all vaccines are 100% effective. If we take, for example, the whooping cough vaccine, is only about 60 to 65% effective. Even in cases in which it is effective, it might decrease the severity of the disease rather than preventing it totally. Therefore, masks are not also do the same work. And remember, most of the vaccines are not 100% effective in eradicating the disease. To add more hope for what we have already said, there is promising data from basic science research also, suggesting that strong cell-mediated immunity results even from mild or asymptomatic SARS infection. Let me tell you, the opposite is also coming out here and there, but the overwhelming evidence is that even a mild infection produces a strong cell-mediated immunity. There are isolated reports of second cases of patients who are recovered from COVID getting a COVID again second time, but they are all isolated reports. Now, so any public health strategy that could reduce the severity of the disease should increase population-wide immunity as well. Therefore, that's a solid scientific basis for this. Now, I suppose you know who this gentleman is. Is it Robert Ray Redfield, and is the director, the present director of Center for Disease Control, which we say the CDC. Other than WHO in public health, CDC is probably the ultimate in public health guidelines. Now, see carefully what he has said. He says, he calls the mask, we will go slowly, the most important, powerful public health tool we have in fighting the pandemic, adding that universal use of face covering could bring the pandemic under control in months. I'm repeating that universal face covering could bring the pandemic under control in months. And he goes on to say, I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine. This is the director of the CDC who has made this statement a few weeks back. And he goes on to say what I emphasize, vaccines are not 100% effective, where a mask won't properly do what they are designed to do. You have heard it correctly. The Redfield, the director of CDC, says the mask may be more effective protection against coronavirus than any potential vaccine. Now, anybody who was on the television for even once in the last 6 months might know who this gentleman is Anthony Fauci, the foremost virologist in the world probably, and the authority on COVID virus. He is in confirmatory, 100% confirms what the CDC director state has already. Let's not lose sight of the plot. The core of the message today is universal masking protects the user. It is not only for the public that we wear a mask, it is for our own sake also. It decreases transmission and severity of disease, and the more infections becomes asymptomatic. And this is the better way to produce herd immunity and bring the pandemic to an end. We cannot stop this epidemic or this pandemic without following solid scientific evidence. We cannot solve our problems with the same thinking we used when we created them. This is so applicable to medicine and to this pandemic. We created this problem because we did not respect science, or at least China did not respect science. When there is a new disease and when it is looking like an epidemic, the first thing to do is to isolate the patient, transparency, reporting to the other people. This is immediately taking opinion of other nation. These are what should have been done. The whole havoc is caused because we showed disrespect to the science. Now we should not be doing the same thing in solving this also. Public health also has got certain scientific tools which are as important as in treatment of diseases like antibiotics and surgery. And the most important scientific tools in the prevention of this epidemic are social distancing, hand washing, and masking. And today we discussed about masking. And remember that masks are just not a piece of cloth. After listening to my talk, I hope you will understand that they have solid scientific reasons to wear them. Well, many of you may not know who this gentleman is, especially the younger generation. He's Gulsal Nal Nanda, who played a stellar role in the history of our democracy. He was the standing Prime Minister in 1964 when Jawaharlal Nehru died, and again in 1966 when Shastri died. In both the occasions, he vacated the position when the new Prime Minister got elected, something which is very difficult to imagine in the present political scenario. People like him played a stellar role in our democracy, and that's why it survived probably for 75 years. It survived for 75 years. They are the unsung heroes of our country. Now, probably the mask also has the same role. It's an unsung hero. It at least has a place of a stand-in vaccine, and you should use it till the vaccines are coming. And probably it is more effective than the vaccination itself. Now, I started my talk by asking a simple question. Is there light at the end of the tunnel in these very difficult times? The answer to it looks like there is a light already there at the beginning of the tunnel. It's only of your question or for your eyes seeing that and adapting to that. Thank you for listening to me so long. If you like this video, please share it with your friends and relatives, because I do feel that this has a message which is useful as well as a message of hope for both medical people as well as the lay public. Thank you.